Okay, why don't we get started? Welcome everyone, and thank you for joining our webinar today, Simplify Your Revenue with a New Clearinghouse Partner. My name is Gary Jacobs, and I'll be your moderator for today's event. Before we begin our presentation, a few housekeeping items. Everyone will be in listen-only mode throughout the presentation. We'll have time at the end for a short Q&A with our presenters. If you have a question, you can enter it in the question window in your control panel, and we'll be able to address some of your questions live today as time permits. But we'll follow up with you after the webinar to address any of your specific questions. Also to let you know, we'll be recording today's presentation, and we'll be sending you a link within a day or so that you can review today's webinar and share it with your colleagues. Why don't we meet our presenters? Todd Bacon and Amanda Kelly-Pazer are with TriZetto Provider Solutions, a revenue cycle management company and a preferred clearinghouse partner. Todd and Amanda will discuss what you should get from a clearinghouse at a base level, value-added features, and how differentiators among companies can transform your practice. Todd, I think you won the coin toss, and you'll be kicking us off. Is that right?
Yeah, that's correct. Thank you very much. So glad to be on today's call, and welcome everyone. TriZetto Provider Solutions, we're a global healthcare leader, one of the largest EDI clearinghouses in the industry. We have an unrivaled client base across healthcare, affecting over 195 million lives supported by TriZetto Provider Solutions and our parent company, Cognizant. Any payers in the industry, typically who you need to do eligibility verifications, claim submission, remits, if the payer can do those things electronically via EDI transactions, TriZetto Provider Solutions is going to have those connections. We're able to do that with over 8,000 payers. We service over 600,000 providers are supported on 340 plus health systems, and we work with over 650 practice management EHR software systems. We have payer connections in all 50 states, Puerto Rico, Guam, Virgin Islands, American Samoa, and we process over 2.5 billion transactions per year, and we have over 34,000 associates supporting our healthcare industry. The TriZetto Provider Solutions product suite, we like to show this wheel slide. Want you to think of us as more than just a clearinghouse. A lot of people know what a clearinghouse does, but we do a whole lot more than that. So everything you would expect for claim submission, remittance advice, eligibility verifications, real-time claim status inquiries, authorization referral transactions. We do all of that, of course, but then there's a lot we can do outside of that, using optical character recognition, converting paper EOB images into electronic remits, of course, workers' comp claims, credentialing services, contract compliance, a lot of different things that we can do that we'll be discussing today. Patient engagement solutions, things that you would expect to typically do at the front office, things like eligibility verification, eligibility discoveries, patient cost estimations, and then your prior auth, pre-auth, and referral transactions. TriZetto Provider Solutions, patient engagement solutions, eligibility. TriZetto customers connect to more than 6,600 payers for eligibility to get the most up-to-date information on patient coverage, copays, deductibles, and more. And the industry average shows that 25% of claims are delayed, denied, or rejected due to issues related to eligibility verification. A little bit of a different animal than just your straight eligibility check is insurance eligibility discovery. This is a tool we'll discuss that helps you to mitigate financial risk by using an automated process to identify a patient's insurance carrier when maybe they don't know or don't present their card with their insured ID for you to check straight eligibility with their payer. You can submit a real-time eligibility request using minimal patient data to multiple payers at once. This helps groups to realize an overall cost savings of $5.50 per transaction. Patient responsibility estimation. This is a tool that can help you to quickly obtain financial estimates at the point of service, either prior to or at the point of service, to help increase patient revenue, decrease billing costs, and improve patient satisfaction through price transparency. 23% of all claims submitted receive no payer-based payment at all, and the number one reason is due to patient deductibles not being met. Electronic authorizations, we can help streamline the process of requesting that healthcare services review by reducing administrative costs and the manual paper-based processing. You can seamlessly receive the response by leveraging that HIPAA-covered 278. Payers who have that capability to do the ANSI 278 transaction, those will be available, and you can see those on our payer list. 92% of physicians say that the current prior authorization process does have a negative impact on patient outcomes. So eligibility, a faster, easier way to verify patient eligibility. Clients can access over 800 payers by utilizing an eligibility API integration. Through submission of the ANSI 270 file and receiving back the real-time ANSI 271 from the payer, clients can quickly and easily receive the most up-to-date information on the patient coverage, copays, deductibles, depending on what that specific payer sends back in their ANSI 271 response. It helps reduce administrative costs, helps you get money in the door faster, increases patient satisfaction. The insurance eligibility discovery, as I mentioned, is a little bit of a different service where you're trying to determine what plan a patient is active in. It's used to discover if a patient has coverage, whether it's otherwise unknown. The inquiries aren't related to a specific encounter, and they can be generated with less data than is necessary for an eligibility verification. You can query multiple payers at one time. So where does the insurance eligibility discovery solution fit into the provider's workflow? Two main places, in your front office and in the back office. So discovery in the front office. Scenario one, the patient arrives for an appointment or they schedule an appointment and they say that they don't have an insurance plan. Scenario two, the patient has provided you all the known insurance information and you still can't verify benefits with maybe that plan that they thought they had. Identifying coverage not provided has two key benefits for the office. It helps eliminate costly man hours collecting from patients who don't pay due to believing that they had insurance, and it builds goodwill with the patients. Not finding coverage may mean that this is a true self-pay patient, and then working with the patient to collect a deposit at the time of their visit and get them on a payment plan while they're still in the office is critical to the office success. Discovery in the back office. So scenario one, the practice is about to send patient statements out to self-pay patients. Scenario two, the office is about to send a batch of patients through to collections. So maybe your practice asked for the insurance card, sent statements, and checked all the boxes, but you aren't getting paid, or you're having returning or not having returning patients. What's the cost of sending that wrong patient to collections? How much does your reputation suffer if you wrongly send a patient to collections? And then do they come back if they potentially have a bad experience? That's where this eligibility discovery tool can be pretty beneficial. So I'm going to dive in and show you what this looks like in real time. This is the TriZetto Provider Solutions web portal. You would be able to go to check patient eligibility, discover insurance eligibility, and in your practice, you could create unlimited groups of insurance plans that are limited to 15 insurances per group that are your specific insurances that you want to check in your region for your specialty. So I'm just going to grab this group one that someone labeled commercial. You would definitely want to put 15 in here because you can check one patient against up to 15 plans at a time. You can also do this via a batch. So I'm going to grab a random NPI. I'm going to put in my first name, last name, date of birth, and gender. And I'm going to check this by health benefit plan coverage, by medical care. You can certainly choose your service type to check by. And when I hit submit, our system is going to ping all of those plans with an ANSI 270 to see if Michael Bacon is active. If I had Medicare in this grouping over here, I would have to also include Social Security number. But there are many plans that will return a response on just first name, last name, date of birth, gender. So I'm going to hit submit. It's sending a real-time ANSI 270 to those payers. You may have to hit refresh if they don't respond in that 2 to 3 second window. And this payer, CHLIC, responded saying, we found Michael Bacon, has active coverage. Here's the payer, Cigna. Here's the patient info. And they did return the patient's insured ID, the patient's group number that you could then potentially plug in to your system. And now you have that info. And they may tell you whether or not the NPI utilized is in network or not. So that's how discovery can work. And again, that can be done via a batch with a batch spreadsheet upload of multiple patients to check multiple payers. Patient responsibility estimation. This is a great tool to help set patient expectations, collect payments quickly, and provide transparency, not so many surprises for patients. 30% of payments now come from patients. In this day and age, more than half of patient payment responsibility after insurance ends up as bad debt for providers. And then patient payment responsibility increased by 11% in 2017, and those numbers continue to typically go up. So the question is, what proactive steps are the offices taking to hold the patients accountable? The patient responsibility estimation tool can help do that. It can reduce collections costs by an average of $1.12 per claim. It provides increased opportunity to collect an additional 30% of revenue up front by having an accurate estimation tool. And research shows that 52% of patients are willing to pay something at the time of service if an estimate is provided. The way this tool works is from the TriZetto system. You can choose the insurance plan. You choose your provider in your roster. You plug in the patient and put in the necessary information to check the patient's eligibility. That's the first step. Subsequent to that, the practice can have in this service line template drop downs of your types of services, whether that's an in-office laparoscopic procedure, rotator cuff repair, physical, flu shot, and then tied to that service line when you use that drop down, those are your specific procedure codes, diagnoses, charges for that type of a visit. You can customize this by deleting a line, adding a new line. It's your estimate that you're building for what if we render these services to this patient with this insurance plan. Behind the scenes, what TriZetto does is we reverse engineer a fee schedule based on your remit history for those codes for that payer and that provider. So we reverse engineer that fee schedule automatically to power part of this, how this tool works. So then when you submit, we're able to identify what the charges would be, the allowed amount, provider estimated payment, co-insurance, whether the patient had met their deductible based on their eligibility response, and it shows that the estimate is that this patient's going to owe $100.78 based on the estimate. Tells you and the patient how that tool is working, and then you can print that out. Has the insurance plan logo, you can have your company logo printed on there, and it tells them that this is an estimate and how the tool works. Electronic authorizations, pre-authorization and referral transactions. Any payer with this ability, you can do from the TriZetto system, authorization and referrals. You go to the insurance plan, in this example, it's Aetna, and you can do an admission certificate, home health authorization, outpatient authorization, specialty care referral. You plug in the necessary information to generate the ANSI 278. You hit submit, and in real time, 2 or 3 seconds, you can get back the authorization number and the response from the insurance plan. Some claims management solutions, claims processing, secondary claims, of course, ANSI 835 remits, built-in claim scrubbing edits, online claims correction, advanced coding edits, claim status inquiry, workers' comp, paper EOB conversion, taking images of paper EOBs and converting them into ANSI 835 remits. So claims processing, we have direct connections to more than 4,000 nationwide payers, making it possible for us to provide electronic claims service for nearly all submissions. And electronic claims certainly do get paid much faster because they're getting into the payer's adjudication system faster than paper claims. Secondary claims can automatically read the patient's primary claims, identify supplemental policies, and take appropriate action. 28% of claims include a secondary payer. Claim editing, we can avoid rework and delays with comprehensive payer-specific claim scrubbing edits that have been compiled by TriZetto over nearly 30 years, and those help proactively catch errors before they're even reaching the payer. Providers can save $15 to $37 for each claim rework that is prevented. Real-time claim status inquiry, that's the ANSI 276 file out to the payer. Payer responds with an ANSI 277. We can access up-to-date status of those claims at any point during the payer adjudication cycle with just a click of the mouse and a real-time response. Providers can save $3.40 for each new electronic claim status request, rather than calling and sitting on hold. The electronic remittance advice, you can receive those electronic remits from payers directly to the TriZetto system, and that those can auto post then into your practice management software and eliminate that need for paper files, manual posting, data entry. Providers can save $2 for every reimbursement that is posted automatically. Paper Resolve, that's the tool I've mentioned that converts the paper EOB images. We can also convert patient payments and correspondence, the paper-based EOBs into 835 remits, and then the others into electronic files for posting. You can reduce associated costs by 60% by eliminating those paper-related processes. And then, if needed, we also offer a Paper Resolve lockbox functionality that can be paired with Paper Resolve, where your lockbox paper images, file, paper, correspondence, EOBs can be routed to a lockbox, and then those can be automatically scanned images to be converted into those paper checks and electronic deposits. You can improve days in AR by accelerating payment and deposit by reducing that float time. Some denial management solutions: Advanced Reimbursement Manager Pro, Denials Workflow Pro, Auto Appeals. Advanced Reimbursement Manager helps to discover underpayments due to late payments, mistaken clinical edits, and more, and of course, straight denials on remits. It gives you the ability to load multiple fee schedules by payer for the highest level of accuracy. Payer rules and edits are applied for precise reporting. You can pull customized ad hoc reports in seconds. And then there's an interactive dashboards that allow for real-time data slicing. 6 to 8% of commercial claim lines are underpaid. In addition, denials cost an average of $25 for typical staff to rework, and 2/3 of those are recoverable. MGMA says that 65% are never reworked and cause a 3% net revenue loss. The reasoning there typically is that the staff is just busy with other activities, or maybe it's just too time consuming to go after, relatively low dollar amount denials or underpayments. But with this tool to help automate finding them and generating appeal packets, it can reduce that amount that it makes sense to go after. Auto Appeals is a functionality that after you are using the Advanced Reimbursement Manager tool to generate an appeal packet, you can actually just push that appeal packet out to TriZetto, and TriZetto can get that to the payer on your behalf. It provides a paperless end-to-end solution for recovering revenue from even those toughest claims. You create the appeals, you upload the attachments, and we take care of the rest. It reduces appeal costs from $25 to $30 to $1 to $5. Some patient financial services, patient statement mailings. You can upload your patient statement output files from your software to TriZetto to have us do the professional, customizable, accurate, timely bills that we can submit out to your patients. You can save up to 1 hour of staff time and $20 for every 100 statements versus doing that in-house. Professional statement design that you're able to customize, your practice information, company logo. If you take credit cards, we can customize the credit card block, custom messaging, And then the data on the patient statement body is dependent on your practice management software output. And then it does print on professional patient statement stock that has a perforated tear off coupon. Your patients don't have to grab a pair of scissors. And then it does include a return envelope. So they just attach the coupon, send the clear plastic window in the return envelope provided. You can send those statements with confidence because it's certainly going through the U.S. Postal Service, which automatically checks outgoing communication against change of address databases. It goes through the coding accuracy support system, which helps correct and standardize addresses, verifies them as deliverable. It goes through the no change of address link, so that if your patient didn't have a change of address on file, you would get notified of that, get a report so that you can reach out to your patient, get that change of address, and get that statement in their hands. And then they are barcoded, both the outgoing and the incoming envelope. So that helps to expedite proper delivery. And then an add-on tool that can be added is digital return mail processing. You can securely receive digitized return mail to protect PHI and decrease paper mail. Credentialing, another service that TriZetto Provider Solutions Cognizant offers is credentialing if needed. So we can do that process, and we can either take over the full process for you or just as little as you want. If you just wanted CAQH updates for your providers, we can do that. We can do everything from the full credentialing continuing process, the provider setup, the data collection and prioritization. We can complete those applications correctly the first time. You have professionals who do that all day, every day, so we know what applications to complete, how to complete it correctly the first time, and then the submission of those applications. I like to share that there's a lot of credentialing companies, if you've ever tried a third party, that do a pretty good job to that point. But then what we hear is a lot of times the credentialing company will then send the practice a glorified Excel spreadsheet that says, here's what we did. Good luck. We hope it works out. We hope you get credentialed. Well, we do the full follow-up, of course. We're doing the payer follow-up. If something were to get denied, it's our responsibility to submit those appeals. We create alerts to trigger continuous and timely communication with the payers, and then all the way through to obtaining the enrollment and notifying you of the obtaining the credentials and the time frame for future follow-up. Again, in that scope, we can do as much as you want or as little. New payer credentialing, first time being credentialed with an insurance plan, re-credentialing, Medicare revalidations. We can do NPI applications, hospital privileges. When you hire a provider that's already been credentialed and they need to be tied under your practice, your tax ID, we can do demographic change paperwork. And then we can do your CAQH profile. We can do the full registration and profile completion for a new provider, or if you just wanted us to do one-time updates, or their full annual maintenance and quarterly attestations. So a lot of different things we can do in the credentialing realm. Those service features, you'd get a dedicated account management and access to the TriZetto Cognizant proprietary Pulse portal that we created, which is a credentialing software that is utilized to keep track of all of your inventory, your re-credentialing dates, Medicare reval dates. It's a good tool for communication between our credentialing team and your liaison for any tasks, necessary documentation to be uploaded, PHI, ENAC certified for the highest security for keeping track and uploading documentation that would be necessary for credentialing processes. TPS credentialing by the numbers, servicing over 16,000 providers. Our credentialing specialists' average years of experience is over 16.5 years each. And then the monthly payer applications, we're doing over 1,500 a month, and we have 80 plus dedicated credentialing account managers. So right here on enrollment, I'm going to pass this over to Amanda, and she's going to talk through some of these slides.
Thanks, Todd. You can go to the next slide. Here at TriZetto, we provide a white glove service with our enrollment process. We've partnered with a company called Medica EDI to make the enrollment process seamless for our providers to meet those specific go live dates. And it's ongoing. The enrollment portal is ongoing. So if there's any new payers that you need to enroll with, that portal is available at your fingertips. We have a step-by-step automation process that helps collect the provider practice and payer data from your system to ensure that all the enrollments are completed in a timely manner. Some of the payers offer a digital signature for the providers to sign, so it helps eliminate having to print and sign those forms, mail them off to the payers, or just simply re-upload them to our portal. Our implementation team, once you are past your go live date, they'll do a 60-day ERA analysis to ensure that all of the remits are being received, to ensure that you're getting that maximum electronic remittance percentage back. Our enrollment portal is also 24/7, so you can go in there at any point in time and see where your enrollments are at in the process, if any have been approved, if any need to be checked on, or etc. So the portal is at your fingertips at all access. Fast and efficient onboarding. We have enrollment teams with a dedicated practice management system focus to allow for quick and accurate enrollments. Our teams are experienced and specifically trained on our PMS settings just to help speed up that enrollment process. We have dedicated resources for clients changing clearinghouses, so they have the expertise to ensure that all of the process for enrolling through a new clearinghouse are completed. Our implementation team, they're a team made up of dedicated reps specific to help enroll with all your commercial and government payers. So they're well versed in those plans to ensure that you get the help that you need enrolling. Our commercial payers plans, they don't require any EDI enrollment to complete, but the ERA enrollment can take between an average 15 to 30 business days. And then the government payers, those Medicare, Medicaid plans, they do require EDI enrollment for the claims and remits. On average, we're seeing about 3 to 15 business days for the claim enrollment to be approved, and then 5 to about 30 business days for the ERA enrollment, depending on those payers. Here at TriZetto, we have different client support. So once you're onboarded, you'll go through our implementation process. That team is a dedicated team that will be working with your practice to ensure that that transition to TriZetto is very smooth and seamless. They'll be your dedicated rep through the process, answering any of your questions that you might have, and making sure that you're onboarded by your go live date. We also have, once you are onboarded and you're handed off to our standard support, we do have a support team that will answer your calls and emails, and they are trained to ensure that they get you a first call resolution, so that we don't have to expedite those or escalate those inquiries to our analyst team. We pride ourselves on making sure that the calls are resolved in one call resolution. Just some stats here. Our team, they on average answer the phones within 14 seconds. So there's always somebody going to be answering those calls as soon as you dial the number. Our call abandonment rate is 1.3. So anytime a rep answers the call and the call is dropped, that's what that's referring to there.
Okay. Yeah, thank you, Amanda. And then with today's discussion and webinar, I guess I'll go through this, or did you want to go through this slide? Well, I'll go ahead. So if you have any interest in potential switch to utilizing TriZetto for any services that we've discussed today, and if you were to do that by August 31st, so the end of next month, you would get 2 months of complimentary service. So if you signed up for claims, remits, eligibility, we would provide 2 months of service where you would start using us. No fees would start until you go live. So if you didn't go live until October 1, then you'd be invoiced on November 1st for those services, and we would credit that back for those 2 months post go live. And then there's our contact information. If you have any questions directly for us, I'm Todd Bacon, Senior Sales Executive, and then there's my email address. And then Amanda Kelly Pajur, AKP, and there's Amanda's email address.
Great, thanks Todd, thanks Amanda, very valuable information there. We do have a few questions from our attendees, so we'll jump right in. Either one of you can respond. First question is specific to dental claims. Does TriZetto handle dental claims, specifically ADA claims?
We do, and our payer list is public, and you can go to TriZettoProvider.com. You want to go to TriZettoProvider.com, not TriZetto.com, because we have a presence on the payer side. And there on our payer list, or excuse me, on our website, you can hover over resources and payer list. And then you want to go to our legacy payer list, Gateway EDI payer list, and there are professional, dental, and institutional options. And you can go to dental, and that can show up there. What you also could do is if the person who had that question wanted to shoot me an email and inquire about that, I can send you those details on how to log in and see the payer list. But we absolutely do have dental payer connections.
Great, thank you. Next question, how long does the enrollment onboarding take?
I can handle that one, Todd. It just depends on when your go live is. So if you wanted to go as soon as possible, we could get you up and running as soon as possible. I can say once you sign a contract with TriZetto, it's sent over to our implementation team within 48 hours, you're contacted. So that team is on it, and they like to make sure that the clients are getting up and running, again, based on that go live. So we can, if you wanted to submit commercial claims immediately, they could work with you to get that done. So it just kind of depends on the situation at hand, but there's no real turnaround time. I would say they could get you up and running within 2 weeks if there's enrollments like Medicare or Medicaid enrollments needing to be done.
Very
and
good.
I would tack onto that, Amanda, and say that if you're in California and you need Medi-Cal, that might be a little bit longer.
Yeah.
Which anyone who's in California is familiar with that with Medi-Cal. Might take 3 or 4 weeks for Medi-Cal.
Mm-hmm.
Appreciate that caveat there. Our next question, are there bundled packages for the products shown today, or is everything standalone?
Yeah, there definitely are bundled packages, and those are things that I don't know if we're referring them directly to me here at TriZetto to discuss pricing options, or if they're going to be working with your team, but we can certainly start that conversation. But yes, if you're looking at bundling certain things together, we do have a tool that we call the Total Office Package, for example, where it would be there would be cost savings for bundling a lot of the different functionalities in together rather than just a core service and tacking on a bunch of different ancillaries. On the flip side, if you don't need everything that we're in a bundled package like that, there certainly is the flexibility that you can choose just a core services package and customize a la carte which tools and services you wanted to add into that.
Very good. Is it possible to switch clearinghouses without any downtime?
I can touch on that. Yeah, generally yes, because years ago, people who ask that kind of question have probably been in the industry a long time. That they know that years ago, when you would do new EDI enrollment with a payer, the payers would shut you off with your ability to submit with your current clearinghouse submitter ID. That's typically a thing of the past. Most all payers allow what's called dual submission. So while you're doing any EDI enrollment setup with TriZetto, to be able to send to like Amanda mentioned, Medicare and Medicaid, for example, you'll start doing the paperwork to get set up with TriZetto to be able to submit, and you'll continue sending business as usual. That maybe 2 to 3 week window at most that it takes to get set up with all of your insurance payers, and to have your insurance payers paperwork done telling them that you want your remits to stop going to your current clearinghouse and to start coming to TriZetto. That time frame can vary by payer, and so we'll do that paperwork in accordance with your target go live date. But while you're doing paperwork with TriZetto, you can just continue business as usual with your current clearinghouse. So there should be no downtime, no time frame when you're not getting paid.
Okay, that's good news. This appears to be our last question. Do you have credentialing experience with FQHCs?
We do. So we get that a lot with behavioral health as well, and certain specialties. So our experience in the industry with those 16 and a half years per credentialing specialist average, time frame in the industry, we're familiar with all specialties. So we do have experience with FQHCs, and we, on the flip side of that, we certainly have a lot of experience with FQHCs for EDI clearinghouse functionality as well. We're very familiar that they have a lot of different specialties. A lot of times they'll have, dental, they'll have vision, they'll have, multi-specialty providers in that group. So we do have experience.
Great. Well, some good questions there. Thank you everyone for submitting them. Briefly, before we let you go, for those of you who may not be familiar with MedTech Solutions, we're showing you a list of our offerings. For information of any of these products or services, feel free to reach out to us here at MTS or check out our website. If you'd like additional detail about anything you've heard today, feel free to reach out. If you know your account manager, you can contact them directly or email us at info@medtechsolutions.com. As a reminder, we'll be following up within a day or so with a link to today's recorded webinar. Be sure to follow us on all of our social media platforms. You'll find MTS on Facebook, LinkedIn, Twitter, X. And we also have a YouTube page with a bunch of educational videos. Go ahead and take a look. I think you'll find some things that'll be of value to you there. Big thanks again to Todd and Amanda for a great presentation. Any last words, folks?
Just again, thanks for inviting us and allowing us to present.
Yes, thank you all.
Thank you. Well, that concludes our presentation today. You all have a great rest of your day. Thank you.